I have yet another FAQ video for you. This time it's Mr. Shahbaz Khan, a TV star in India, a household name, and he had got a hair transplant from us some years back and is very happy with the result. He's a good friend now and he would like to ask us some questions that came to his mind and he asked at the time of his procedure some 4 to 5 years back. Yes, Mr. Shahbaz Khan.
Hi, Dr. Bhatti. Sat Sri Akal. This is Shahbaz Khan here. Dr. Sahab, I wanted to ask you a couple of questions about hair transplant. First and foremost, I wanted to know what's the technique of hair transplant?
Mr. Shahbaz Khan, the technique that we used and the technique that we used on you as well is a modified DHI technique. A technique which has been modified to suit my philosophy, my clinic, my expertise and skills in hair transplant. The technique is anagen Q plus technique, in which we endeavor to only harvest the anagen grafts, and therefore our graft count is always less than many other clinics because we only target the anagen hair. The anagen hair are the ones with good potential for growth, and hence we do not target other hair which might be a little less, which may compromise the result. So this anagen Q plus technique is described more in my video which I have published here, and the essential features of this technique is basically choosing anagen hair only and moving the hair in the shortest possible time to prevent increase in out of body time. As you know, out of body time, if increases the ischemia time or the time the graft is without blood supply. The more the ischemia time, the less is the growth. So we decrease this out of body ischemia time by in vivo preservation. That is, we preserve the grafts in the donor area itself till the entire harvesting, coring is over, and then extract them immediately within a matter of about 10 to 15 minutes. While they are lying in the donor area, cored but not extracted, they are soaked with copious amounts of PRP with A cell. This further increases their survival, and as you know, more the survival and more the potential of growth, the better the result, as in your case. The other modification is making pre-made slits into which the grafts are slided in by the trained staff in my clinic. The front few rows are transplanted manually because in the front few rows, the curl, the direction of the hair is of paramount importance towards the naturalness of a result. So our implanter pen is a little different from the CHOI implanter. And we have been doing this technique for almost like 10 years now.
And sir, what would be the cost of a hair transplant surgery?
The cost of hair transplant in my clinic is generally 89 rupees per graft plus GST, which is about 18%. So it comes to approximately 100 INR per graft, including the tax. Now this is the cost that we charge in the peak months, which stretch from end of July till March. During the summer months, that is April to June, we give a discount so that people who cannot afford our rates at higher level can get the hair transplant done. Also because the flow of patients to the clinic during the summer months, when people do not have vacations, when people are busy with their work, the flow is less, and hence we give lower rate to patients to encourage them to get the hair transplant done. So this lower rate is 70 rupees per graft plus GST. Now if you want a hair transplant at 50 rupees per graft, then you can avail yourself of the waiting list or waiting list against cancellation. Now this is applicable only to people who are staying close by, because if there's a cancellation and we come to know about it within 24 to 48 hours, there's a sudden cancellation, to fill that spot, because otherwise it will be a waste to the clinic, loss of revenue. To fill that spot, the patient, if he's ready to come within a notice of 24 to 48 hours, we give him that rate. Now this is beneficial to many people who reside within a 500 kilometer radius of Chandigarh. And presently, during this COVID crisis, we've been giving discounted rates to almost everybody because of reasons which you can easily guess, because the workflow is very low. While understanding our pricing as compared to other clinics, you must realize one point, that we do only one case in a day. We do not burden ourselves. by doing 5-10 cases a day. 5-10 cases a day can lower the cost to almost like 70,000 or 80,000 rupees for the entire procedure. But we do not do that so that we safeguard the interest of the patient by giving him due care that he deserves, because hair transplant is a once in a lifetime event. If the procedure is not supervised properly, if the harvesting is not done by the doctor himself, it can mess up with the results, which to rectify may take a long time, and rectification is much more costly than the first surgery. As you know, grafts are limited, and if grafts do not grow in the first instance, you have lost them forever, because the donor area is not a limitless zone. Donor hair do not grow back. The donor area is very precious. Every graft that is harvested must be made to grow. And this can only be done with due diligence, skills, and proper supervision without needing to rush the operation. So this is why our costing is considered little higher than other clinics in the region. However, this is the best we can give if we have to maintain our standards and if we have to do only one case in a day.
Sir, when does hair grow back after transplant? I mean, how much time does it take?
The hair transplant, once done, the planted hair go through a phase of shedding. Between 1 month and 3.5 months, in most of the cases, like 67-70% of the patients, his head will look similar to what it was in the pre-hair transplant phase. That is, there is no visible growth. Roots are retained under the skin, but the hair have shed off. It is only at 3.5 to 4 months in some patients that wispy thin hair begin to show. The area starts darkening a bit. But it's only till 5 months that there is a sizable change in the appearance. But this change is not the result, because hair are still thin. Many hair have still not grown and it's see-through. But there is a change. It is only between 6 months and 9 months. And mind you, this timeline is only for those who are taking DHT blockers like finasteride. It is between 6 months and 9 months that hair growth is such that we refer to it as lush, and the patient is happy. Some people are slow growers, the others are fast growers. Most people shed, some people, less than 5%, do not shed. People who do not shed will obviously get a hair transplant result faster. A younger person will get a result faster, that is between 5 to 6 months. An older patient will get his result by 9 months. The complete result is attained at 12 months, that is a year after the hair transplant, after which there's very minimal growth, unless you have body hair from zones other than the beard and chest. They keep growing till about 2 to 4 years. So this is about the timeline of growth.
And the hair which grows back, is it permanent or?
Yes, if the hair have been taken from the permanent zone or the safe zone of the donor area, which varies from person to person, and everybody doesn't have a permanent zone. So if a person has a permanent zone and we confine the harvest only to the permanent zone area, the grafts will survive a lifetime. As long as you have good quality hair at the back of the head, the donor area, till then the planted hair will survive. And usually this is a lifetime. In senile alopecia after the age of 55, 65, in some patients, hair overall begin to thin. And that is the time these transplanted hair will also mimic the condition of the donor hair at the back of the head and will start to thin. So we can say that planted hair, if taken with due diligence, due care from the permanent zone, will last a lifetime.
It's a very important question. What safety measures are taken by Darling Buds for this Covid-19 during the surgery?
Shahbaz sir, for COVID precautions, we have a strict COVID protocol in place, whereby all the staff members, all the people who are patient handlers and other ancillary staff, they are tested for COVID routinely. Patients who come to us, their number is restricted. I do not see more than 2 to 3 patients in a day, and their appointment time is staggered. It's not that all of them come together. Patients are seen without their attendants, friends, relatives along with them, so that we do not overcrowd the facility. As before, even before the pre-COVID era, we were following the one patient a day norm, and we still follow it. Just one patient in a day does not cause overcrowding. It decreases the chances of cross-infection. And as you can see, we have a very big facility. There is a lot of space. So it is very difficult for one patient to come in contact with another who's visiting in the outpatient department. All the staff, the technical staff, the nursing staff, the operation room staff, maintain an adequate distancing. Even in the operation theatre, you will see that there is no overcrowding. We follow all the government guidelines during this pandemic. And we have an exhaustive COVID form. Before a patient comes to us, he's required to fill up that form of any illness in the recent past, any fever, any cough, any breathlessness. People usually do not come for a hair transplant if they are suffering from an illness. But still, to be on the safe side and to follow government guidelines, we have a COVID form which everybody has to fill up. The staff also has to fill up. So the patients stay in hotels which are COVID compliant. We have hotels nearby, and we also have a few rooms in our setup where overcrowding is not done. So these are the precautions that we have enforced during these troubled times. I think they're going to continue at least till the first half of 2021.
Dr. Saab, also wanted to ask you, is there any kind of swelling or after the transplant? And if it is there, how long does it last? And how unbearable is it?
There is no swelling. Even in your case, after 2 days you flew off to Calcutta. Do you think there was any swelling? The airport would not have allowed you in the craft had you had swelling of the face. You would have looked sick. Most of my clients, above 50%, come from abroad. And for them to stay, for the swelling to subside for about 7 to 15 days in India would not be acceptable. Most of my clients leave after 36 to 48 hours to their hometown, which could be as far away as Northern America or Australia. So this is because of the technique that we use, the minimally invasive FUE technique, in which we do not puncture or injure the underlying vessels, that we are able to prevent the development of swelling. Do your research. Research is power. Well, thank you, Mr. Shahbaz Khan, for the time you spared for my audience, for my subscribers on YouTube, for my subscribers on Instagram. And I'm very grateful to you. And I can see you're enjoying your result. And do visit us when you come to Chandigarh next. Stay safe, stay happy. Bye-bye.